Very excited to welcome back to the program once again, public health expert, epidemiologist, and the author of the just released Medicare For All, A Citizen's Guide, Dr. Abdul El-Sayed. Welcome back to the Damage Report.
Hey, thanks so much for having me. Always a pleasure to be with you.
Very glad to have you back on. So I believe the last time you were on, it was more than a year ago. A lot's obviously happened since then. Your book has come out recently. It's about Medicare for All. And tell me, what was your focus in this book? And because obviously we're in an opportunity now where in theory, Medicare for All has become a little bit more likely than it was, 6 months or a year ago. So what's the focus of the book? What's the objective?
John, you're absolutely right. I mean, most people have heard about Medicare for All in political circumstances. They've heard political backs and forths that don't really cut to the heart of the issue, which is that our healthcare system, despite being the most expensive in the world by far, with costs rising, putting 67% of all people who go through a personal bankruptcy into that bankruptcy, that we get mediocre outcomes at best, and our healthcare system was not able to deal with the crush of COVID-19. We have a responsibility to have this conversation and to talk about it in clear policy and more importantly in human terms. And so the book was about trying to take it out of the political and talk about it in the personal. What is it that people talk about at their kitchen table? What makes them fret? What are they worried about? And our healthcare system is frankly one of them. And we have an opportunity to rethink that. We ought to be doing it. This is the moment. And this book was intended to be a conversation restarter for us about what we could do to build a more just, equitable, and sustainable healthcare system.
As you point out, obviously many people have been through medical bankruptcies, even those who haven't. Many feel like they're paying way too much for their healthcare. I'm curious, do you think it's gotten to the point where people understand that this isn't just a thing where they're going through rough times, that perhaps some of this is baked into the system of healthcare and health insurance that we have in America? Do they get that in theory, a lot of this could change with a switch over to something like Medicare for All?
I think folks are starting to pick that up. The reality of it is in the past when we talked about health reform, it was usually a conversation about how do we provide healthcare for lower income people. And that is a critical conversation and unto itself is a reason why we should change healthcare. But what's happening today is that even people who think that they are quote unquote insured by the system, are finding that system is failing for them. We profile a woman named Lisa Cardillo, who had the unfortunate circumstance of her husband having had a brain tumor 3 years before she had a freak form of cardiovascular disease that hit her at 36. And they are insured based on her husband's employer. And they were stuck in a situation where they had to have their friends and family throw a fundraiser for them to be able to just pay for the deductible, which of course is a paywall that health insurers put in front of the healthcare that you and your employer already paid for if you're lucky enough to have private health insurance through your employer. And so this is just not working for the median American. I mean, you look at the deductibles today, you're talking about the average deductible is about $3,655 for a family of four. And that family of four, the median family of four is earning $69,000 a year. That means it's more than a full paycheck. And we know that too many Americans just don't have that. And so it is a principal cause of bankruptcy. And it's not just low income people, it is people who thought that the system had been there for them. So it is stemming and building a conversation among all folks about what we need to do to actually take this on. And I believe deeply that if we are willing to come together to organize around building a healthcare system that we deserve, that we can get there. And I'm really quite confident of that. And I hope that this book is simply more fuel for this conversation.
Yeah, and hopefully the conversation will be happening now that Trump is out. We have Joe Biden, who has not personally, he's not a fan of switching over to Medicare for All. But we get Joe Biden at the same time that we're still in the midst of this pandemic that's claimed, we're approaching 500,000 Americans who have died as a result of it. How does that change the calculus? Joe Biden says he's not interested in it. Is there still a path in the next 4 years that could possibly lead to Medicare for All being passed?
Well, I'll tell you what, I'll never give up on a path. And the point that you make is a really important one. It's that this discussion was litigated in the primary, which was largely something that took place in late 2019 and early 2020, just as COVID was starting to hit us. Now we have lived through this pandemic for a year. We account for 20% of all global deaths, despite accounting for only 4% of all people, meaning we're 5 times as likely to die of COVID-19 in America than the global average. And so this is a different moment. Our healthcare system was tried and tested and found wanting. And we have an opportunity to decide whether or not we think that tinkering around the edges of that healthcare system will solve it, or if we recognize the need to fundamentally take on the structure of the system itself and take on the health insurance industry, which is nothing more than a middleman that profiteers off of people's bodies, fights them for the healthcare that they already paid for, and does so in a way that accelerates the cost of healthcare. Now, look, I sat on the Biden-Sanders healthcare task force, and I know that the Biden team was not running on Medicare for All. And we push them to a truly public option. We all know that that's not enough. But right now, we have a responsibility to solve the broken healthcare system as it stands. And so even if we don't get it under the Biden administration, I want folks to remember that you can kick a field goal and come back the next possession and score a touchdown. And we have to be committed, no matter what happens, to setting our eyes on the prize and being willing to continue to fight for Medicare for All, because that is the change that we need in this country.
Yeah, I mean, we know that when you poll people, it's quite popular, even though the public defense or advocacy for it is relatively young, and there's far fewer voices in that than the constant attacks of it being a socialized takeover of health insurance and all of that. And not everybody opposes it for the same reason. Some people think it's communism come to America. You have Democrats who don't support it, but don't talk about it necessarily in those same terms. What do you think are the most important sources for opposition that we can potentially combat? Is it misinformation? Is it campaign finance from vested interests that would be ousted by a switch over to Medicare for All? What does the opposition look like, and what can we potentially do to fight back against it?
It is the coalition of healthcare corporations that benefit from the system as it stands today, and the way that they spend principally in two ways. Number one, fear mongering through legal disinformation about what Medicare for All would do in ad after ad that they spend millions of dollars pushing into our eyes. And then the second is the amount of money that they spend lobbying. In 2020 alone, right, in the year of the pandemic, the health insurance industry, let alone pharma, let alone the hospitals, health insurance spent $151 million lobbying across 845 lobbyists. There are nearly 2 lobbyists per member of Congress. That's why, right, the solution that seems to have some consensus around it for solving the unemployment and health insurance loss crisis, right? 15 million people who lost their health insurance because they lost their job, is through a COBRA subsidy. Now, here's the thing. Health insurance has never been more profitable than it is during a pandemic. Those health insurers didn't have to pay for elective procedures, and they lost coverage for the lowest income people who also tend to be the sickest. So they made money in Q2 of 2020 alone. Anthem Healthcare doubled its profits versus 2019, and they've spent that money to go and double dip in the midst of this pandemic, asking that the American taxpayer, in effect, give them money to do the thing they should have done, which is keep those folks on their health insurance in the first place. And so, those two issues, the way that they can spend to try and fearmonger to the American public, and the way they can spend to reshape public policy in their own interest, that really has to be what we take on. In the book, we have a chapter called Organizing versus Advertising, right? They're going to keep advertising, they're going to keep fearmongering. There's not much going to change about that. But what could change is that when all of us come together and realize that we are all in this thing together, none of us get the healthcare that we deserve in this country simply because of the way that the system works, that we come together and we build common cause and we take them on. It is our vote in the end that matters most for these politicians, and we've got to make it matter.
Yeah, and to that point, you said it would sort of been litigated a little bit in the primary. People should bear that in mind. Get involved in these primaries early, and potentially we could have a candidate who would champion it. The book is Medicare for All, a citizen's guide, but I know that you've also recently launched a newsletter. Could you tell us about that?
That's right, it's called The Incision. And the hope was to take some of the momentum from this book and my last book, Healing Politics, and create a space to develop some of these ideas. In fact, I hope folks will sign up tomorrow. We're dropping an article really laying out the way that the health insurance industry is trying to double dip in the midst of this pandemic. And really want for folks to understand that once you cut through the surface level, you really do see the way that money and power tend to wrap themselves around many aspects of our lives. And so talking a lot about healthcare, but also talking a bit more about the way that race gets in the way when it comes to public policy, about our education system, and about the way that we consume and produce information. So I hope folks will check it out. It's incision.substack.com.
Awesome. Dr. Abdul El-Sayed, thank you again for joining us.
Thank you so much for having me, and thank you for keeping the drive alive. We've got to win the future for Medicare for All.
Thank you.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.